Good morning. I'm Dr. Velasquez, Health Officer for Spokane County. Thank you for joining us today. And today I have two of my colleagues from the Spokane Regional Health District. To my immediate right, I have Jennifer Hansen, who is a health program specialist. And then to my far right, I have Dr. Rumiana Kudeva, who is with the as an early childhood specialist. These are very long titles, but it's very important that you remember because it pertains to what we're going to talk about today. So thank you for being here. And over the last several years, we've heard a lot about social isolation and how that impacts different generations. We've heard a lot about it, through COVID and after COVID. We've heard a lot about it from our schools, from our community partners. So I think today we want to talk a little bit about what you all have done to try to address that issue in the community. So first of all, since I said what your titles were, can you tell what is it that you do at the Health District? I'm going to start with you.
Oh,
Jennifer.
great. So I am part of the Beginnings Matter program, and we focus on building a resilient Spokane County where parents and children can thrive. And so what that looks like day to day is we try to break down silos and connect providers so they can provide better services to families, connect families so they can have more supports naturally. It's a lot of connection.
A lot of connection, which is very, very, very important. Rumana, how about you? Tell us what you do.
So I'm the other part of the Beginnings Matter program, work with Jen, and as part of that program also we focus on the prenatal period.
Okay.
So I lead the Perinatal Collaborative of Spokane County, where many different people come, like not just from healthcare, but also from mental health, social service sectors, public health. And we talk about the work we do in the community to support perinatal health during pregnancy, postpartum as well. And we also further the work around the HOPE framework that we'll talk about a little bit more.
Yeah.
And we use the framework to also inform how we gather information and data that is local here in Spokane County.
Wonderful. So that's the whole continuum across the community. So I understand that based on the work that you do, you have put together what we're calling a learning series about social connections for parents, caregivers, and others. Can you tell us a little bit more about that?
Yeah. Well, why don't you talk about
You
the
start.
survey?
So yeah, let's talk about the survey first. So before even the idea of the learning series came about, we were interested to find out what is happening locally around social isolation and social connection, because we knew there's a lot of data, national and international, about these issues, but we don't really know what's happening in Spokane County around social connection. And we were even more interested in around the perinatal period and up to 0 to 5, because we know from data, national, international, that really that's one of the sensitive periods when people do become isolated. So we developed the survey, The Social Life of Parents, and we gathered data based on existing survey items. They were validated, so we used those. But really our focus was around also positive experiences for adults.
Got it.
So HOPE framework stands for Healthy Outcomes from Positive Experiences, but that's focused on positive childhood experiences.
Okay.
We use research that's focused on positive adult experiences. So we ask parents and caregivers of kids 0 to 5, what are their experiences with accessing things around the community that it contributes to strengthening their social connection, that helps them with social supports, it helps them with, breaking those challenges around isolation and loneliness. So after we came up with the report and the data, we wanted to socialize that information with community, and that's how Jen had this brilliant idea of why don't we start something that's continuous, that we call partners from the community to come together, not just to learn about the data, but also for them to connect with each other.
Wonderful. And I was going to take full credit for that, but you pointed to that she did it, so I cannot do that. But you went and measured and assessed. Then on the basis of that data, these are the actions that we took. So, which I think is the right way of doing things. It's sometimes I see a lot of efforts we just kind of run, but we don't know what we're trying to address. And then the impact may not be what you expect. So as you do all of this work, you've mentioned connections, communication, collaboration, which I think is very, very important. What would be the ideal outcome of all of this work for the two of you?
Ooh, well, I can say for me, the ideal outcome would be that the HOPE framework, the Dr. Sege Healthy Outcomes from Positive Experiences framework, is adopted by every service provider, every system within Spokane, so that there's a level of engagement with families that is strengths-based across the board. I would love it if there could be more warm handoffs between providers
Okay.
because people know each other. And it just makes the entire experience more rewarding and more pleasant all around for people being served and the people serving.
Right. Also, we'll be more consistent if we're all kind of following the same approach.
Yeah.
Any other thoughts on?
Yeah, and not only the approach, but also that approach shapes also
Yeah.
the narrative in the community
Got it, yeah.
of how do we talk about families and kids, and then how do we see ourselves as community members, what our role is to support access to those positive experiences. Because, and Jen says that a lot when we train people, but this is not something extra. You know,
Right.
it's something that's absolutely fundamental for everybody's well-being. And health and educational attainment and economic growth later in life. Like there's so much research coming up on really like the return of the investment in this, like access to the positive experiences in childhood or later in adulthood if the person didn't have access to them in childhood. So there's so much we can do as a community, but if we don't change how we talk about this, that it's not just the personal responsibility, it really is community responsibility to support families and support kids. We're just gonna continue seeing the same results, and we don't want that.
So you mentioned a couple of things like outcomes, improved outcomes, overall economic impact for the individual, the family, and the community, which is a lot of people say, well, we shouldn't talk about economics. And I go like, actually, we should.
It's
We
important.
absolutely
Because it is
should.
important. Sometimes the economic outcomes determine what a person or family or community does or doesn't do. So I think that's very important. You also mentioned warm handoffs. And elaborate on that a little bit more if you can, because I'm going to pitch in a little bit with what I've heard in many other areas in the community. So let's talk about that a little bit.
Sure. One thing that was surprising to me when we started the Social Connection series is that providers don't know each other. And the more providers know each other, know what is being provided, being offered within our community, the better everyone is able to do their job and meet the needs of the community. And so that is what I
Wonderful.
was thinking.
Yeah. And
Yeah.
I'm glad you brought that up, and I'll tell you why. Because there's a lot of work being done in the community. So I hear sometimes, oh, we're not doing enough. I go like, no, actually,
There's a
lot of work.
lot, yeah.
The issue is that not everybody knows
Yeah.
What's
everything.
happening.
Exactly.
So I think being able to make those connections and share the information is crucial, because you may find synergies,
Absolutely.
you may find partnerships, you may find collaborations that otherwise will go unnoticed. And I think as a community, we do really well on a lot of stuff. We have to do a little bit of more work on sharing what we're doing and making sure that everybody that should be
Yeah.
part of the conversation knows. So,
Yeah, well,
yeah, go ahead.
We actually evaluate like all the series after each meeting, and that's been overwhelmingly the feedback from folks that they really value and appreciate learning about what others are doing, and that's why our focus is hyper local. We only invite speakers
Got it.
from the community. But that's exactly what they highlight, that's really one of the biggest benefits is not just learn about the work, but also learn about the people who are doing the work.
Great, and actually, I'm part of a couple of other community efforts, and that's is always the number one value that comes out. Okay, now I know and I'm connected, and now I know someone that I should know, and I didn't know. And maybe now we can do something. So let me ask you, so people probably out there in the community are wondering, okay, that sounds wonderful. How can I take part on this? Are there going to be additional training sessions? What's the future look like for this whole process?
Well, coming up, we will be focusing on a different population group, so social connections in K to 12.
Okay.
And so we are in the process right now of recruiting the planning team from different areas within Spokane to help make this the best it can be. And then we will be advertising it through our channels here at the health district. So if people are interested, they can follow us on Eventbrite, check our website, watch Facebook,
Check our social media.
check our
Yes.
social media.
And the series are free for everyone to attend. You don't have to be a service provider to be there. We do encourage families and youth, to be part of it. We also, always at the series, depending on the building block we're addressing, we try to bring up resources from providers
Okay.
there too, so you can, learn more about what's out there in the community and you can bring it back to your community. So there's a lot of opportunities for folks to be, engaged.
Are these in person, hybrid, virtual?
In person,
Okay.
that's the best way
Yeah.
to really connect, we have
Yeah.
found.
Yep,
And we
agree.
take turns like in different libraries around the
Okay.
community.
So you go in different
So
areas?
yeah,
Okay.
folks have access to them.
No, thank you to our partners in the library for.
Oh, yeah, both the
Absolutely.
city and the county, they're incredible.
So I'm glad to hear we're going to move on to the next level and work with K through 12. As you know, K through 12, we do a lot of work with K through
Yes.
12 because that's where you have the next two generations that are going to be it. And anything and everything we can do to make sure those children and young adults have the best possible outcomes will be not only good for them, but will be very important to the community.
Yes,
So thank you for
absolutely.
doing that. So as we start to sunset today here, I'm going to ask you, what message do you want to leave for the community? I'll start with you, Romana, about this.
I would say just find something you feel strong about, like in contributing to social connections, because there's so much we can be doing. So find something you're passionate about and do it. That's not going to just benefit your community, but also benefits you. And learn more about positive childhood experiences. They're very easy things to implement in your daily life as a parent, as a caregiver, as a neighbor. So we all really can do something around access, to those experiences.
Wonderful. Great message. How about you, Jennifer?
I will leave with my favorite quote,
Okay.
which is the grass is greenest where you water it. And I want Spokane to water the positive. And I want positive experiences to be readily available to every child, every person in Spokane.
There's a wonderful message for I hope everybody was listening. So find something you're passionate and
Yes.
do it. Sometimes we just talk about it, but I think it's more important for the individual, and I speak from my own experience, when you actually get engaged and do it, and always bring the positive.
Yes.
Life is never perfect. There's always some ups and downs. We'll have them. There's sometimes things that are not very positive, short time. But I remember something that someone told me a couple of years ago, is someone that actually had a very complicated life. He said, nowadays I don't allow myself more than a bad moment a day, as opposed to a bad day, just a bad moment. Shake it off and move on. So with that, we're going to say thank you to our two team members, Jennifer and Juliana. Thank you for all the work you do in the community. I know that you guys are out there all the time, hear from the community, very, very good things.
Aw, thanks.
And for those that are listening today, keep an eye on our social media, the website, the other places we put information to, so you can check out future trainings. Remember, we're going to start focusing as we go forward in K through 12. A lot of K through 12 students around here, so I'm sure everybody can learn something, and is open to the public and it's free.
Yes.
Yes.
So there's really no restrictions. So with that, I want to say thank you again. Thank you to all of you. Thank you to all of our community partners. We wouldn't be able to do all of these things without you. And thank you to the community for joining us today. Stay safe, stay well, and we'll see you again next week. Thank you. Have a great day.